would describe, if the month of October ever had a color, then I think it would most rightfully be pink. Yeah, a very vibrant, powerful shade of awareness, hope, and action. And as is the case, we are today to talk about Pink October, breast cancer, and reconstruction with two bright minds, two doctors who are specializing in this field. First of all, on my right, we have a consultant breast surgeon, Dr. Melissa Tan. Good morning, Dr. Melissa.
Good morning, Anil. Thank you for having us both here today.
Pleasure's ours. And when she said the boat, yeah, here's another man who's dressed in a suit. He is a consultant plastic and reconstructive breast surgeon, Dr. Kenneth Koch. Dr. Kenneth, welcome to Traxx.
Good morning, Anil. Thank you. Thank you for the
welcome.
nice introduction.
You're welcome. Pleasure's ours. So to start things off with, let's set the scene. I want you to let our listeners know on the field that you specialize in and your years of work. I think that deserves more recognition because that would just further stamp everything else that you're going to talk about over the next 30 minutes. Dr. Melissa, how did you end up being a consultant breast surgeon?
So I've been a doctor since 2003.
Right.
Graduated from the UK. And I've actually lived in the UK for 28 years. Just got back to Malaysia 2 years ago.
Right.
Essentially been a consultant for nearly a decade.
Mm-hmm.
So starting from general surgery to subspecializing in breast and now oncoplastic breast and reconstructive surgery.
Right. Okay. Dr. Kenneth Koch?
Yes, so to those who don't know, Dr. Mel is my wife.
Oh, wow. Really?
Yeah.
Oh, wow.
So
First time ever I got a husband and wife duo I'm interviewing. All right, go ahead.
it's always time for a first. So I also trained in the UK.
Right.
I went to the UK in 1995 and
Okay.
qualified as a doctor in 2000.
Okay.
And then I qualified as a plastic and reconstructive surgeon in 2012. So I've been a consultant for 10 years. And my wife and I decided to come back to Malaysia after 28 years being abroad. So we've been back for 2 years now and no regrets whatsoever.
Right. Okay. Now, there's another thing that I would like to tell everybody that you wouldn't regret. For a visual cue, yeah, apart from listening to the audio, you can log on to TRAXXfm Official's Facebook page, yeah? Producer Fida, is that where we're streaming the interview right now? If you want to get a visual cue and see how this dynamic husband and wife doctor duo look on camera. Dr. Mel, on to the topic. We think we've flirted enough with the word Pink October in the opening. Now, when women first learn that they may need breast surgery, what worries do you as a doctor hear the most?
So when women first learn that they need surgery, usually the feeling they feel is fear.
Right.
Fear of the cancer, fear for their lives, fear for their family and loved one. Also fear of the unknown. How would they cope with the treatment? How would they feel and look? And how would their very close one react to them? But of course, our goal is to move them from that place of fear to a place of hope with education, knowledge, so that they can feel empowered throughout their cancer journey from diagnosis and treatment to recovery and survivorship.
Right. Okay. A couple of weeks ago, I actually had the pleasure of speaking to someone from the National Cancer Institute. And she was speaking about an initiative that they have to provide a free breast cancer screening for women. And then they're talking about the awareness for girls. So we touched on that. Now, assuming a woman has already diagnosed, she knows that she's diagnosed with breast cancer. Tell us about the main surgical options for the condition. Lumpectomy versus mastectomy.
So the two main treatments for breast cancer treatment is lumpectomy.
All right, lumpectomy. Apologies, yeah.
We usually call it breast conserving surgery or wide local excision.
Right.
And mastectomy. So mastectomy in the past, the entire breast is being removed. But now, if the skin and the nipple is cancer-free, we are allowed to keep them. And patient can even have immediate reconstruction.
Right.
As for lumpectomy, is removing the cancer lump with the margin of healthy tissue.
Right.
And this space where it's being removed can be filled with surrounding breast tissue or even with surrounding fat tissue with what we call partial breast reconstruction with chest wall perforator flaps.
Right.
Sometimes this lump can be removed and the breast can be uplifted at the same time. And these are what the modern advances of breast reconstructive an oncoplastic breast surgery is.
Right. Okay. Dr. Kenneth, is there anything that you want to add to what Dr. Melissa mentioned earlier?
Well, I think when we're talking about breast reconstruction, you can look at two things really. The first is the timing of the surgery, and also the second is what are the options available for that reconstruction. So first thing to say about timing is, I think Dr. Mel alluded to earlier, you can do an immediate reconstruction at the time of the cancer excision, which has its own benefits. The second thing, of course, you can do it delayed. Once the cancer treatment has been completed, then you can go ahead and do the reconstruction at a later date. Now, in terms of the options of reconstruction, you either have implant-based reconstruction or using the patient's own tissue.
Right.
And the choice of reconstruction really depends on what's been removed during the breast cancer excision.
Okay.
So, for example, if only the breast tissue has been removed and the skin has been spared, then an implant-based reconstruction is a good option.
Okay.
If skin has also been removed, then you need to replace that skin. And in a patient, usually the skin can be taken from either the tummy or the back, but there are several options that can be used.
Is this a breakthrough in medical technology, the fact that breast reconstruction can be done for patients who have been diagnosed with breast cancer, Doctor?
No, actually, we've been practicing breast reconstruction for maybe the last 40 or 50 years.
Wow. Okay.
But of course, there's always advances going on at the same time. So, things are always progressing.
Right. Great. Let's jump in for a quick break. When we come back, we'll continue our conversation right here on Health on Traxx. I'm today having the privilege of having a conversation with a husband and wife, Dr. couple, Dr. Melissa Tan and Dr. Kenneth Koch. And they are here today to talk to us about Pink October, breast cancer and reconstruction. Don't go anywhere. Anil on the mic. We'll be right back. back to Health on Traxx. In short, it's called HOT. Yeah, the 2025 stretch of our Monday's interview segment where we focus on no-nonsense conversations concerning your health. And today, we are here to talk about breast cancer and reconstruction since it's Pink October, a time of the year every year, yeah, from the 1st to the end of October, where it's dedicated towards creating awareness on breast cancer. And with me today, our lovely husband and wife duo who are both doctors practicing, medicine. First of all, I have Dr. Melissa Tan. She's all in red. And then we have Dr. Kenneth Koch, who's closest to the Asian version of James Bond that I have in the studio today. And he's got a pink October. Both of them have got a, what do you call that? You got that lapel pin on you, yeah.
Pink ribbon.
A pink ribbon, yeah?
Yes.
So that is to show solidarity towards Pink October month, yeah?
Yes.
Right, okay. Dr. Kenneth, now let's touch on surgical options and personalization. You mentioned that earlier during the break that you touched on it a little bit, and we stopped at taking the skin from either the back or the tummy to reconstruct the breast. What are some of the other options available for breast construction? If you can elaborate a little bit more on that, doctor.
Yeah, I mean, I think essentially, as a reconstructive surgeon, we do need to see what's been removed from during the breast cancer excision. And so if you think about the breast itself, it's actually quite a it's quite a easy to understand structure because you've got the skin,
Right.
and then you've got the tissue.
Okay.
So what you remove is what you reconstruct. So essentially, if we're taking tissue from somewhere else, that's reconstructing the skin and some of the tissue. And if there's not enough tissue that's been provided by the tissue from the patient, then you would supplement it with an implant
Okay.
to provide the volume.
Okay.
And then, of course, we can also do symmetrizing procedures to the other breast to make them both look as similar as possible.
Mm.
And then finally, not to forget about reconstruction of the nipple and the areola, because sometimes this is lost.
Mm-hmm.
It is almost like the icing on the cake because
Right.
you're providing a new breast. And if you provide a nipple and an areola as well, it just brings everything together.
Wow. So, okay, this is a curious cat in me thinking out. If there is a woman who is yet to deliver a child, and she gets breast cancer, and she has to go through reconstructive surgery, which affects the nipple, the places that you mentioned. Does that mean that once everything is perfectly done, she can breastfeed as usual?
Very good question. So, of course, we are replacing like for like. And what I mean by this is we're replacing skin with skin,
Right.
and we're replacing tissue with tissue.
Right.
But we are not giving the patient a new breast.
Right.
So the breast does not function as what it used to do,
I see.
but it might have the appearance of a breast.
A breast.
Yeah.
Okay. Now, this next question, I'm going to split it into two. Once a surgery or procedure has been done to omit anything cancerous for someone who's suffering from breast cancer, is there a chance that it may reoccur again? And how does that affect reconstruction for future treatment? Dr. Mel.
So it is important for us to know that mastectomy does not guarantee breast cancer for not coming back. And also, we have touched upon lumpectomy and mastectomy. We already have level 1 evidence to support that.
Right.
Lumpectomy with radiation therapy, if safe to do so, offers overall survival benefit to mastectomy.
Right.
Now, of course, breast cancer can come back either locally around the operated site in the breast, in the chest, or in the armpit glands,
Okay.
or even somewhere else in the body, like in the lung, liver, bone, or even brain. When this happens, it's important for us to discuss our patients in a breast cancer multidisciplinary meeting because patients often need to see our oncologist to start whole body systemic treatment, which involves anti-hormone, chemotherapy, targeted therapy, or even any other novel therapy depending on the breast cancer subtypes. And if it just occurs in isolation around the operated site in the breast, then we will supplement it with further surgical excision.
So when we talk about breast cancer, primarily which parts of the breast does it affect? So what I'm thinking is you've got this frontal portion over here facing forward, and then some people tend to develop some excess lump as well underneath their armpit. So is that the area, Dr. Mel, that we are?
So the breast attachment is on the chest wall, usually from the thoracic level 2 all the way down to 7. but it goes all the way up to the armpit as well. And if it does spread, it spread to our regional lymph glands, in the armpit glands, below the collarbone, above the collarbone, and then distally to other organs, like I've mentioned before.
Right. Dr. Kenneth, let's just move away from reconstruction and talk about how does breast cancer actually occur. Is it hereditary, or does it come due to maybe a particular way of life that we're leading?
So, of course, I'm not a breast cancer expert.
Right.
I'm a reconstructive surgeon. However, I do have some knowledge on this.
Sure.
I think with all cancers, not just breast cancer, there are many, many factors.
Right.
Hereditary, as you mentioned, gene mutations is one of them, but also lifestyle.
Yeah.
In terms of breast cancer, of course, smoking increases your risk of cancer. Perhaps your diet,
Right.
exercise, whether you have a child, whether you become pregnant, whether you have early menarche, you start off with your periods very early in your life,
Right.
or late menopause. All these are factors that can cause the development of breast cancer.
Dr. Mel, I read somewhere that 1% of men are susceptible to breast cancer. To what extent is that true?
It's very true.
Right.
So of all breast cancer we see, 1% affects men.
Right.
Yes.
Okay.
And-
And they go through the same procedure that women would have to go through as well when it comes to addressing it, curing it, and so on.
From the cancer treatment point of view, yes.
Okay.
Except I don't think many men would want to go down the route of reconstruction.
I can do it though.
Yeah, it can be done
Yeah,
if they
because-
want to.
Because I'm very encouraged to have another long conversation with Dr. Kenneth, because I'm slightly on the obese side, and I've been told, like, I feel like I have gynecomastia, so I probably need some reconstruction, because it's a bit difficult for me to get the right fit shirt for me when I go shopping. We'll talk about that off air later.
Yes, sure.
Let's go for a quick break for us to entertain that conversation with Dr. Kenneth. But just to let everyone know, if you just tuned in, you're now listening to Health on Traxx on TRAXXfm Radio Malaysia. This is a conversation that comes on every Mondays from 11:15 to as long as it can go, right before the news at noon. And today I'm speaking to Dr. Melissa Tan and Dr. Kenneth Kok, husband and wife couple. And they're today shedding some light and talking to us about Pink October, which is dedicated to breast cancer and also reconstruction. Don't go anywhere. I'll be right back. Words of glory again. At first I was afraid, I was petrified. I couldn't think of myself surviving without you by my side. Not here to sing, I'm here to have a conversation with two doctors. Welcome back to Health on Traxx with Anil on the mic. With me today is Dr. Melissa Tan as well as Dr. Kenneth Koch, here to talk to us about breast cancer and reconstruction. Welcome back to the two of you. Dr. Melissa, now let's talk about emotional and psychological considerations, yeah? What emotional challenges do women face during breast cancer and reconstruction, and how do you help them set expectations?
So when one hit with bad news, for example, breast cancer,
Yeah.
it is normal and natural to go through stages of grief. And these stages of grief is non-linear.
Right.
And a woman can feel any of these emotions at any point of their journey, including depression, and anxious, anger, anxiety, or even acceptance.
Right.
So, of course, it is important that we understand these emotional challenges so that they feel supported throughout the process.
Right.
In terms of managing reconstruction expectation, patient needs to know that it's not vanity, it's about knowing what reconstruction options they have, because it's about living well and beyond survivorship as well as treating the cancers. So it's important for them to see before and after photos so they know what to expect, potential risks and complications, and what can we do in situation where we have unfavored or desirable outcomes so that they feel more confident throughout this process. Like Dr. Ken have mentioned, we are not exactly rebuilding a breast, but we are reconstructing a breast that only will look and look the same, but also to provide that postural balance. And these patients will feel empowered to embrace the new normal self.
Now, could there be a scenario where breast reconstruction is not possible for a patient due to any other factors?
Yes, Anil, you just hit the head on the nails. Of course, not everyone is suitable for reconstruction. And I'm a strong advocate that early detection changes everything. Not only it saves lives, not only it simplifies the treatment options we can offer to our patients, but we can also save breasts in terms of avoiding mastectomy, or it's easier to reconstruct breasts.
Right.
Because the cancer is not that advanced or aggressive.
Circling back to emotional support, Dr. Mel, for women who are diagnosed with breast cancer. As a doctor, what would be your message to the women out there who fear that they will be judged, they will be looked upon differently? Because for a woman, things like her hair, for her to gracefully walk and let the wind just blow it and then just enjoy the sun and dress up and wear her favorite sundress and, be herself. These are all things that remind a woman that she's a woman. Like what we talked about earlier as well, breastfeeding a child. These are the bedrocks, the hallmarks that make a woman a mother and a woman a woman. What do you want to tell them, Dr. Mel?
Don't be afraid. every scars, every breast cancer treatment that you survive is a marker of your strength and resilience, and how you have shown women hope that there's life after breast cancer treatment. So you're not alone. Share it, get help, and it's no longer a taboo. And it's not vanity, because research has already proven reconstruction not only offer physical and femininity and even sexual well-being, but also psychosocial well-being.
Right. Okay. Dr. Kenneth, now let's go on to recovery, your area of expertise. What would a typical recovery timeframe look like? And if you can share any tips for a smoother healing process, please do.
Well, I think that's quite a broad question. So recovery really depends on the extent of the initial surgery and what reconstruction you have, right? So smaller surgery, smaller recovery.
Right.
Bigger surgery, longer recovery. But I think in general, most wounds from surgery are healed within 2 weeks. And then after that, I'd advocate using scar management techniques such as silicone gels, massaging and moisturizing the scars with vitamin E. And because we know that scar maturation takes any time between 6 to 12 months. And it's quite important to carry on this process during that time, especially for us Asians, where the skin and the scars are more prone to becoming bad scars like hypertrophic and keloidal scars. And there are treatments for this, so I think that's quite important. On top of that as well, use of garments, so post-surgical garments, and physiotherapy after surgery is useful. And as a general rule of thumb, anyone having surgery should try to start a high-protein diet with whole foods, generally a few days before surgery, and try to carry it out on during that healing phase of about 2 weeks. And this can be supplemented with vitamins, minerals. And of course, also don't forget that patients need positive psychological and social support from their loved ones. And this often helps smooth out the recovery process.
Yeah, that's very important, to be able to have some people to hold your hands and walk you through the recovery process. Just as, go back earlier to something that you mentioned, the proportions of the breast when did you aim to reconstruct? Yeah, because, sometimes you are just so comfortable walking with a particular in your body weight, right? So, like for instance, for me, I have this belly, and for some reason, I've just learned how to deal with it, and I can walk up a flight of stairs and walk down or do heavy activities with this belly around me. But some people might have been used to something, and then your job as a doctor is actually to bring them back to where they were. Exactly. So it's a bit of a very tricky process. You get what I'm trying to say, right, Doctor? Yes.
I get what you're trying to say.
How do you strike that balance?
So actually, it's about the consultation and discussing with the patient what the issue is.
Yeah.
So I had a patient who wanted a reconstruction.
Okay.
And she had quite a large breast on the other side, the unoperated side.
Right.
And it was a very simple question. I said, what do you think of your other breast? She said, Doc, I actually think it's too big. So I said, okay, well, we can reduce that side and give you a reconstructed breast on the other side to try to match it. So there's many, many things that can be done.
Right.
And I think it's really about having that consultation with the patient to find out what it is that they're after.
Right. Okay. Now, another question, Dr. Kenneth. How is breast reconstruction evolving, and what can patients expect in the future in this field of treatment?
Yeah. Well, there have been several advances in breast reconstruction in the last few years. I mentioned earlier in the show that breast reconstruction is not new. It's been around for 40 or 50 years.
Yeah.
But really, with advances in oncological treatments and our understanding of breast cancer, there's more and more partial breast resections being performed as opposed to mastectomies. And this obviously has led to advances in oncoplastic surgical techniques like what Dr. Mel has been trained to do, whereby you can remove the cancer and then actually just readjust or remove the breast tissue around to provide a breast that is cosmetically acceptable.
Right.
And therefore no further reconstruction that is required. Another advancement is fat transfer. So this has been around for the last 15 years, but is being practiced more and more. It involves performing liposuction to another part of the body to harvest fat cells and then transferring these fat cells into the breast to provide volume and shape. And I think this is quite a major advancement in the last 15 years.
Okay. All right.
We use silicone implants a lot, and they've been around for about 40 years, but we're now in our 8th generation of silicone implant. So the implants are very robust, they're very safe, a very long safety record, and they can be placed into the breast, above the muscles, beneath the skin, and still provide a good reconstruction.
Okay.
I mean, the other advances that are happening these days are things like 3D imaging, robotic surgery, virtual surgical planning, and the use of AI in planning surgery. But these are all very much in their infancy, and I think in the next few years we'll see what comes up from them.
Okay. Now, both of you are doctors. I'm sure you would have had an opportunity to speak to many patients, answer their doubts, clear whatever that's in their minds. So I want to take this opportunity to pick on your brains a little bit and help our listeners. Let's clear some fallacies, some, myths. Maybe I'm not going to, hammer them out. I'll let you address the myths that you've commonly heard and then, clear it for our listeners. We'll start with you, Dr. Mel, about breast cancer and treatment. Yeah.
Yes. So breast cancer diagnosis is a life sentence.
Yeah.
Wearing underwire bras can cause breast cancer.
Okay.
Wearing deodorant can cause breast cancer.
Okay.
Drinking soya milk can cause breast cancer.
I've heard that a lot. I love
That's
tofu.
not true. Yeah, it's not true because it works differently on a molecular level.
Right.
So not being breastfeed, yes, it could contribute towards a risk factor, but it's not going to cause breast cancer.
Right.
Having larger breasts is
Yeah.
not a reason for breast cancer, but having denser breasts is. And starving your cancer, not just breast cancer, with sugar
Right.
can result in cancer coming back.
Right.
And that's not true also, because every single part of our cells need glucose. And even if you starve yourself, your liver will end up making your own glucose to support the living of your other cells. So, but being obese can increase your risk of breast cancer. So having a body mass index of 30 can increase your risk of breast cancer by 30%. Exercising of less than 150 minutes a week can increase your risk of breast cancer by 15%. So
Right.
one more important thing, that HRT, hormone replacement therapy or menopause hormone therapy, can cause breast cancer. And that, again, is not true.
So these are all the fallacies.
There's
that you
so
said.
many more.
So many more. Anything to that many more you want to add, Dr. Kenneth?
I think she's covered most of them.
Okay.
I would say that
Yeah.
breast implants don't explode in the air.
Yes.
Oh, yes. When you're 40,000 feet
Yeah,
out.
they don't.
it doesn't-
Or they don't explode in scuba diving.
In scuba
either.
diving. Oh, wow.
No, yeah.
See, this is what I love about these kinds of conversations.
And one more.
Yes.
Breast cancer is not contagious.
Ah.
You can kiss, you can hug, and you can even have sex if you feel like it.
Right. There you go. Wow. What a conversation to have in the middle of Pink October. Dr. Melissa Tan, consultant breast surgeon. Dr. Kenneth Koch, consultant plastic and reconstructive breast surgeon. I have to say, both of you are an absolute dynamic duo. You both compensate each other really well in helping our listeners understand about this topic today. It was such a pleasure having the conversation with you. But before I let you go, one after the other, we'll start with Dr. Mel. What advice would you give to women who are considering reconstruction, especially when they consider things like timing and also being ready personally?
I think before I have a last message, again, early detection does save lives, simplify treatment, and we can save breast. And if you were to consider reconstruction, please consider it upfront, because it's not about vanity. Research has already proven that restoring breast physical femininity wellness is going to restore your psychosocial wellness as well.
Right. Dr. Kenneth?
I agree with everything that my wife has said, not just during this conversation, but generally in life.
Right.
There's some advice for you men out there.
Yes, thank you. Thank you.
But I think, when faced with breast cancer, patients are generally more concerned about the breast cancer resection. But I think the first thing is you must not. You must consider reconstruction. You must go and have at least a chat with a reconstructive surgeon,
Okay.
so that you find out what the options are. It's not for everyone.
Yeah.
You might not agree to it at the end of the day, but at least you know your options. And the reason for that is because immediate breast reconstruction at the time of your resection actually does have benefits both from a physical and psychosocial point of view.
Yeah.
So I think anyone out there who has breast cancer, I'm very sorry you have that diagnosis, but do think about whether or not a reconstruction would be suitable for you, and have a chat with an expert.
Okay, great. Dr. Melissa, Dr. Kenneth, thank you very much. Just want to recollect on my past experience with Dr. Melissa. 1 year ago, exactly on one of these days, it was a Tuesday, I interviewed you on our segment called W Talk, but unfortunately it wasn't in person, so it's such a privilege to have you in front of me, just a few steps away. And during that interview, I fondly remember, because I have a moment during my W Talks where I call it a seed planting moment, where I give my guests an opportunity to look into the camera and plant some seeds of inspiration for the many millions of women and girls who are listening, and where there could be anything to empower them, to inspire them. So it would be a waste if I never made use of this opportunity again for you to impart some wisdom. It doesn't matter if it's not W Talk. There's a camera over there. Look into the camera and inspire the girls out there, Dr. Melissa.
So it's normal to be afraid and be fearful, but let's be positive. Have hope. You're not alone, and we are all here for you together. It's very treatable.
Thank you very much for being generous and candid with your thoughts. Dr. Melissa Tan and Dr. Kenneth Koch wish the both of you a blessed year ahead, and have a wonderful day. Take care.
Thank you.
Thank you, Anil.
You're welcome. All right, that is a wrap for our today's edition of Health on Traxx. If you missed out on any part of this very fascinating conversation I had with Dr. Melissa Tan or Dr. Kenneth Koch, worry not. We have this replay available on TRAXXfm Official's Facebook page, where you can head over there, watch it. And if you think that this might be of benefit to any of your friends, feel free to hit that share button and spread the word and spread the wisdom that we've learned today on the show. Turning our attentions over to the clock right now, we're about 4 minutes away from the strike of the hour, so that means up next, a very important agenda in our programming, the news at noon to keep us informed with 3 minutes of whatever that's happening in the country. Right after that, back to what we do best, play you great music. By the way, this next song is a request by Dr. Kenneth Koch, apparently a big fan of John Mayer, and title of the song is Wild Blue. Wild Blue for you, Dr. Kenneth.